on a bike for some extended period of time, things start to go numb. And that's usually a response to some type of pressure on the area.
Welcome to the Motion Lab, the podcast that explores the science of movement and helps you live a stronger and healthier life.
Welcome back to the Motion Lab podcast. My name is Chuck Dowell. I'm one of the physician assistants here at Colorado Springs Orthopedic Groups. I'm here with Darin.
Hi, I'm Darin. I'm the lead physical therapist here at Colorado Springs Orthopedic Group.
All right, so this week or this podcast, we thought we would talk about cycling in general, but also mountain biking. We're from Colorado. Mountain biking is a huge thing here. As we're staring out the window, it's snowing, so we're not mountain biking today. So we will kind of try to address indoor cycling and spinning type stuff. But I work in the express care clinic here where I see acute and chronic orthopedic injuries, and Darin obviously works in the physical therapy department, and we see a lot of mountain biking injuries. So we thought it would be good to talk about some of the common injuries we see and potentially what you can do and or what we can do to help prevent these injuries or limit these injuries. So Darin, from a therapy perspective, what are the common things you see from mountain biking, cycling in general?
So a lot of crash accidents.
Yep.
So we're seeing anything from AC joint separations, clavicle fractures, forearm fractures, just people sticking their arms out as they go down. Other than that, it's mostly overuse related injuries. So tendonitis of various origins, patellar, quad tendonitis, some IT band syndrome, patellofemoral syndrome, stuff like that, just from over quad activation.
Yeah, I think we can break kind of mountain biking, cycling accidents. Obviously not indoor spinning. Hopefully you don't crash on the indoor spin bike. Otherwise, there's other problems. I think we could break them up into two categories, acute and chronic. And acute categories, like you said, oftentimes it's the downhill that typically we see this in, and usually it's kind of a fall over the handlebars, and upper extremities account for probably 70+% of those injuries because we try to put our arm out to catch ourselves, or we try to tuck and roll and we end up breaking the collarbone, separating the AC joint, or kind of having wrist fractures. So those are probably the common things I see in the express care clinic from an acute perspective. And then the lower extremity stuff, probably more road biking, flat plane biking, spinning classes you see from the tendinopathy standpoint, correct?
Definitely just overuse, maybe a poor bike fit, kind of segue into some of those overuse injuries.
Yeah, so from an acute perspective, that's obviously sometimes uncontrollable. We sometimes can't control the conditions. I think speed plays a large role in it as far as going downhill, appropriately knowing how to use your brakes, front brake versus back brake, trying to control the descent. A lot of the times we'll get forward on the bike and that will cause us to go over the handlebars, so kind of balancing your weight on the bike when you're going downhill I think is helpful.
Yeah, you see a lot more of those fall type injuries in advanced terrain, which there's not a whole lot you can avoid with that, or just beginner level bikers, kind of unsure on how to orient themselves on the bike.
Yeah. So I think that's the big thing. Mountain biking, especially downhill mountain biking, has become huge. There's a lot of terrain or kind of park mountain biking. We'll see more of the catastrophic injuries, the concussions, the spinal cord injuries, from the jumps and that type of stuff. I think, as you said, if you're a beginner mountain biker and you want to pick the sport up, it's important to kind of start slow and maybe start with some friends that are more experienced and have them show you the appropriate technique as far as going downhill and how to control that descent so you don't lose control and some of those more traumatic accidents will happen.
Yeah, there's definitely courses you can take too that are related. We're here in Colorado Springs, but that are local. It can take you out on some of the trails and give you more of a one-on-one training too till you're ready to kind of push the envelope a little bit. Yeah,
that's great. There's probably a lot of people willing to teach courses as far as that, and I think we got to put our pride aside and remain safe and try to control those the best we can. Obviously, if you do have some type of acute injury, we're always accessible at the Express Care Clinic because it's a walk-in clinic, and we could see those fractures and decide if it's a surgical or non-surgical treatment, and then appropriately get you a sling and whatever it may be. Lacerations happen quite often as well, and abrasions, and we can do all the wound care treatment for lacerations and abrasions as well. Going on to the more chronic side, which is probably the bigger part of this discussion because that's more controllable for us, what do you think are some of the factors that play into some of these tendinopathies or chronic injuries?
So like we mentioned earlier, poor bike fit.
Yeah.
So seat too low, we're going to get a little bit more friction on the IT band, just some abnormal loading through the knee.
Yeah.
Just going from a static climate, not doing any activity, to going out biking several miles. That could irritate something like a quad, patellar tendon. Just that overuse, kind of going from couch to activity. So doing something like a good dynamic warm-up, kind of building up to that biking distance will also help reduce some of those injuries.
Yeah, and I think, proper bike fit obviously plays a huge role in it. We know that, the adjustment of the seat, whether it be forward or backwards or higher or lower, significantly changes the biomechanics and kind of, the neuromuscular recruitment of the lower extremities. So as you said, seat too low, we're putting a little bit more quad dominant patellofemoral stress, IT band type syndrome. Seat too high, maybe a little bit more hamstrings and, a glute kind of, so you'll get more proximal gluteus kind of trochanteric bursitis type symptoms. And then that will translate forces across the feet and ankles as well.
And it's going to ride you a little more forward if you're up too high. A little more pressure down on the handlebars, maybe irritate that median nerve, ulnar nerve on the grip.
For sure. And I think, those neuropathies, which we all feel if you've ever been on a bike for some extended period of time, things start to go numb. And, that's usually a response to some type of pressure on the area. So you can get some saddle anesthesia, from, sitting on the, the bike seat in maybe inappropriate kind of bike seat for you and your just natural, anatomy. You can get the, numbness in the hands, as we were talking about, either, so that some of the fingers will go numb just from too much pressure. That's the vibration. Sometimes going downhill, you're putting a lot of pressure across your hands. And so I think all those things can potentially be controlled by maybe adjusting the fit of the bike.
Definitely. And getting good equipment. Bike shorts.
Yeah.
Make cool ones now. Some people wear wrist guards. Help kind of stabilize that wrist, get them in a better alignment. Obviously a helmet. Always recommend wearing one of those.
100%. Yeah, a lot of bike accidents are uncontrolled, especially if you're road biking, mountain biking. I don't think you need a helmet during indoor cycling or spinning.
Maybe it depends how crazy that Peloton class gets.
Depends on if they turn the lights out and they're really just pumping the music. But I think gloves can be obviously helpful for those kind of hand neuropathies. Some people will get numb feet, and sometimes that's the shoes being too tight or maybe the appropriate pedal position or foot position on the pedals. As we were talking about, I think, I've been there before. I saw the outdoors. I moved to the, Colorado area, and I was like, oh, let's get out there and do some mountain biking. And I had, an old mountain bike, so I just jumped on it and got out there. And as you said, I had some of these kind of couch to mountain bike type, chronic injuries. And I think the second season, I decided to go get a kind of a custom fitting for the bike. I think the fitting decreases your risk of injury and improves your efficiency on the bike, especially with mountain biking and road biking. And so I would definitely encourage, maybe not the first season, see if it's something you like to do, but the second season, go to a bike shop. There's a lot of good bike shops in town. You can go get a custom fit, make sure that seat height and everything is kind of in the appropriate position.
Yeah, 100%. Bike shops, several all over town. Go in there, they're always helpful. I've been into a couple myself, and they'll always kind of readjust things, give me some pointers, kind of get me in the right path.
Yeah, and I think even if, let's say we're doing an indoor cycling class, so again, we're staring at the snow outside, and today's a perfect day to go to indoor cycling or spinning class. Great ways to get low impact exercise, to lose weight. But I've been there before. You get to a class, everybody seems to know each other. You're very kind of shy. You sit in the back, and maybe that bike's just not completely set up for you, and it causes some injuries, and you're deciding whether I should go back or not. And the instructors are always trained on how to set the bike up appropriately. So I think it's, they're always happy to help you. Definitely go to the instructor and see if they can set it up. Just, I think from a general perspective, as far as the seat height, let's say they don't kind of want to get a fitting, what's the recommendation on that? Do you know?
So typically, bone on the outside of the hip, greater trochanter. I kind of try to make that about level with the bike seat.
Perfect.
That'll give you a rough estimate, and you can kind of make micro adjustments from there. But that gets you in the ballpark. And when you're on the seat, you want basically almost full extension of that leg. So if you drive one leg down, it should be almost all the way straight with just a slight bend in it.
Yeah, so that's kind of what I've always learned. If you're sitting on the bike, your bottom leg or kind of the foot that's all the way down should be in about 20 degrees of knee bending. A little bit more than that, obviously, as we talked about, maybe causing some more stress across that kneecap joint. A little bit less than that, maybe causing some foot problems because you're trying to kind of reach the pedal, and even some hamstring problems from pulling. Try to sit on the bike, have that one leg all the way down with the foot in a neutral position, so not pushed down, not pulled up in a neutral position, and have that knee maybe just slightly bent, 20 degrees or so.
Yeah, 100%.
So as far as like the common things we see, so we talked about kneecap type pain, whether it be patellofemoral syndrome or IT band type syndrome. What are things that we can do other than bike adjustments to prevent that or treat it if we do see it happening?
So again, we were kind of beating a dead horse on this, but dynamic warm-ups, that's the key. Get in 5 minutes before the class starts.
Yep.
5 minutes before you start riding outside,
Yeah.
and do some dynamic warm-ups, leg swings, some squats, maybe some lunges, stuff like that. I like to throw in some arm circles, just kind of get the shoulders ready to kind of brace for any impacts that when you're out on the trail.
Yeah. Yeah, and I think, in an indoor cycling class, what I like to do is, like he said, if you can get there 5 minutes early, great. If you can't, maybe that first 5 minutes of class, you take it pretty easy, no resistance, kind of just ride that bike just to get kind of the blood pumping and a little bit of sweat going. And then a lot of those stretches you can even do on the bike. Stand up, have one foot back, stretching that heel cord and that Achilles tendon where we see a lot of tendinopathies or inflammatory changes. You can kind of just pull one leg up to stretch that quad, even kind of bend forward to stretch the hamstrings.
Some frog hops as you're walking into the class. Yeah.
That always puts a good impression into everybody's mind, right? Hey, look at this person frog hopping into class.
Then you definitely want to sit in the back.
Yeah. And I think obviously the trail riding and the road biking, it's hard to jump on the bike. I mean, you can jump on the bike, and if the trail allows or the road allows, try to kind of just really take it easy. Don't put a lot of pressure into the pedals. Stay flat ground for the first 5 minutes, and then even kind of unclip or jump off. Do a light little stretch just to get those muscles loosened up.
Yeah, right around a couple circles in the parking lot. Usually parking lots around here are big enough you can kind of get a little bit of warm up in.
But I think, as I've gotten older and a lot of these kind of, things have accumulated with a lot of the activities I do, I've understand the importance of a warm up and even just a stretching to reduce the risk of injuries, because a lot of those things can be prevented, just with a slight warm up, get the blood pumping to the muscles, and then a stretch, knowing that the quads are going to be a big activation, the hamstrings, the calves, and so, really trying to get that stuff stretched out. Even the low back, in some of the mountain biking positions, we can sit more upright. In some of the road biking positions, we're sitting more leaning forward, and that can put a lot of stress across that low back, and so we'll even see some low back complaints.
Yeah. So also work on some stretching afterwards.
Yeah.
Spend 5 minutes after biking.
Yeah.
Kind of stretch out the quads. They're going to be tight. A lot of stress on the quads with biking.
Yeah.
Low back, stretch that out.
Yeah.
Give yourself 5 minutes. Don't hop in the car and head to the brewery.
Yeah, we've all been there though, right? Like you hop in the car, you head to the brewery, you get out the brewery, and you're like, oh my gosh, I can't walk, because everything just like stiffened up. And, then I kind of stretch different muscles, and kind of exercise those.
Those 12 ounces?
Yeah, that makes the pain go away, definitely. So from, we talk about this, and we've talked about this in previous podcasts, which I think is important, but a conditioning aspect. So, we go through our first season, we understand biking, we say, hey, this is great for us, we like it, and we want to get better at it. We can definitely get better through some exercises, getting stronger with specific things. What are some things that you would say, hey, these are good exercises that can translate to getting you stronger with cycling or biking activities?
I say squat and lunge-based activities are probably the best. Wall sits.
Yeah.
It's an easy way you can kind of squat down onto a wall, hold it for 10, work up to 30 seconds, a couple sets of those. That's always a good start. Working on some lunges. You can use your stairs at home.
Yeah.
Something like a Bulgarian split squat, which we can kind of show a demonstration of later.
Yeah.
Putting one foot on the step, kind of doing a split lunge.
Yeah.
Stuff like that will help build the quad strength up. It'll also activate the glutes.
Yeah.
And then core is a big one, kind of underappreciated with cycling. Gives you kind of that foundation, that base of support.
Yeah.
So a lot of core work, bird dogs, planks, stuff like that, which we'll kind of run through some demonstrations of a little bit later.
Yeah, I think core is a huge one because as we talked about, a lot of the times the upper extremity overuse type stuff, not traumatic stuff, whether it's the numbness and tingling in the hands, the pain in the shoulders from kind of holding your, or the pain in the neck is all from you leaning forward and putting a lot of pressure across those handlebars. And ideally we want to be stabilizing our core and kind of barely putting any pressure across those handlebars. And that core will fatigue over time. And so maintaining that core strength, I think, is helpful. And out of the saddle stuff is obviously very difficult. When you're going up a hill and you need to put that extra pressure across the pedals and you get out of that saddle, that's a very uncomfortable kind of position. And so practicing that, like you said, with those single leg type activities where you can stabilize those glutes, put a lot of pressure across one leg and be able to hold yourself in an appropriate position. And so that's where I think those lunges, those Bulgarian split squats, the single leg activities can be quite helpful.
Definitely, yeah.
And muscle endurance is obviously big, especially if we're going for long rides and road cycling. And I think that's where those wall sits, help quite a bit, right? Yeah. They build up that muscle endurance.
Get that quad burning.
Yeah. So again, we just thought it would be fun to do an episode on cycling, mountain biking, all those types of injuries that we commonly see. Obviously, as we talked about, some of the acute stuff is not necessarily preventable, but can be if we kind of, have appropriate technique as far as downhill activities and we try to control that descent. And some of the overuse things can be preventable as well with appropriate warm-up and some exercises. If at any point you're doing these activities and you have any of these injuries, again, the Express Care Clinic is always open for acute walk-ins. Darin and all of his physical therapists are always open from an exercise perspective. Sometimes, as we talked about in the past, it's just 1 to 2 sessions with a therapy to try to teach you how to do the exercises, and then you can kind of incorporate them on your own, right?
Yeah, definitely. Like we talked about some of these other podcasts, just come in, get a list of exercises, stuff you can work on, some stretches, some warm-up stuff.
Yep.
And then a couple of visits, probably get you well on your way.
Perfect. And then from a bike fitting perspective, we don't specifically do that here, but there's a lot of bike shops in town that I think can be helpful for that. And if you're really into the road biking, you're really into the mountain biking, and you want to kind of increase your performance with that, I think appropriate fit on the bike can help increase performance and reduce any overuse injuries. So anything else you wanted to add?
No, basically dynamic warm-up, work on some stretching after you ride, get a good fit, and ease into the endurance and the distance.
Yep. Yeah.
Otherwise, go have fun.
Yeah. Exactly.
Hit all the jumps.
I feel like you buy a new toy, you buy a new bike, the first thing you want to do is go out there for a 15-mile ride, and you don't realize until you're 15 miles in that you got to ride back. So always keep that into perspective. I've been burnt by that before, and I'll admit I had to have be picked up. I had a flat tire and I didn't have a spare, so that was a problem. I wasn't appropriately ready for that ride, but I wanted to test the new toy out. So we appreciate you for listening to the Motion Lab podcast. We hope to do more episodes like this in the future. Again, please feel free to leave comments or reach out should you have specific things you want to have addressed, and we're always happy to talk about it.
Yeah, leave us a line down below and see if we can get to some of those questions.
All right, we'll see you guys in the future.